you can track the status. So with this platform, you cannot have the chance of the patient to say, yeah, I did it, but I don't know why it's not recorded. But of
Yeah.
course, you're gonna see the track of the activity of the patient, how many time it took, the level he was facing, and how he or she performed.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab Practice Solutions, where we are on a mission to humanize healthcare. And speaking of humanizing healthcare, with Christmas coming around, I'm going to make my pitch for the perfect gift. Better Outcomes, A Guide to Humanizing Healthcare is the book that we just recently published through Business Expert Press. It's available on Amazon, Barnes & Noble, wherever you buy books online these days. And it is a book that I wrote specifically for frontline clinical staff and organizations that serve patients directly in the clinic. And the idea behind the book, or the main premise behind the book, is that for far too long, healthcare decision makers have been driven mainly by calculable numbers. If you can't put it in a spreadsheet, if you can't make a pretty graph from it, then it doesn't really get much forethought. There are a lot of times where decisions get made in healthcare based purely on the numbers without any real thought to the impacts, the real life impacts that those decisions have to patients receiving care, and then also the clinicians and the staff that are delivering that care. So Better Outcomes, A Guide to Humanizing Healthcare outlines what I consider 8 fundamental changes that organizations and clinicians need to make and need to commit to in order to return the focus of healthcare to where it should be, the patient. Again, the book covers topics related to truly patient-centered care. We cover a biopsychosocial approach to service delivery, patient engagement, and even how you can use a biopsychosocial approach to improve and streamline business practices like the administrative side, onboarding new patients, scheduling patients, all of that kind of stuff. We cover interpersonal communication skills, and then the focus is developing long-term relationships with patients that we can leverage on behalf of those patients to improve outcomes both on the business side, but then more importantly, on the clinical outcomes and the satisfaction side. Through an exploration of both clinical research and real-life examples and cases, the book outlines and supports a vision for a new healthcare where skilled, competent, and caring clinicians care for engaged patients to promote better outcomes, deliver unmatched satisfaction, and lasting patient relationships. So again, the book is called Better Outcomes, A Guide to Humanizing Healthcare, and you can find it on Amazon, Barnes & Noble, wherever you buy books online, and we'll link to it in the show notes. Okay, this week we are having a conversation with Miguel Besares. He is from Neurological, which is a platform. We'll talk about it here, or he'll share more about it, but it's basically a repository of tools and activities for individuals focusing primarily on functional cognition. And these tools are printable, they're deliverable online through a telehealth platform, they're customizable, you can individualize a treatment per each patient or client that you're working with. And it's a way that we can, or that clinicians can leverage technology to streamline the process of planning, let's say a plan of care or course of treatment for an individual, for a patient, without having to do what many clinicians and clinics do, which is have either a giant file cabinet full of paper activities and things like that have notes all over them, sticky notes, highlighter, all that kind of stuff. It kind of streamlines the process and makes it a platform that both is a repository for all of those activities, but then also a method of delivery for those activities that tracks compliance, adherence, improvement, and performance on those activities as well. So it gives you, the clinician, or the clinician that's working with the Neuron.app, the data they also need to prove medical necessity, to prove any kind of need for the continuation of services. So I'm not going to take up any more time. Let's dive right in. Without any further ado, here's Miguel Besares talking about Neuron.app and leveraging technology to serve individuals with neurological and functional cognition impairments. Well, hey, Miguel, welcome to the show. How are you?
Hello, Rafi. Great. How are you doing?
I'm doing wonderful. I want to talk about Neuron.app and about the cognitive rehab platform you've got. But before we do that, tell me a little bit about yourself and kind of what brought you to doing what you're doing here at Neuron.app.
Of course. I'm Miguel Besares, a sales manager of Neurona for the US market. And yeah, my background is based in sales and marketing. And it's just my second month in the company, so I will try to do my best here.
Awesome. Cool deal. Well, tell me then about Neuron.app. What is it? It's a platform, right? And kind of what does it do?
Of course. Neurona.app is a neuro rehabilitation or cognitive platform that was created by a psychologist. Is our CEO, and is basically a tool for professionals. I want to make this clear. It's a B2B platform and has to be used as a tool or in order to make the strategy for every user or patient.
Yeah. And you ran through a demo with me a little bit ago, and it's basically to help clinicians, right? It's got a big repository of activities and assessments and all of that kind of stuff, right?
Yeah, in fact the origin of the platform is when Inigo, the CEO, was as I told you, he's a psychologist. One of his main pain points was that the time consuming there was organizing the sessions, downloading all the materials in order to prepare the week, and that was the first pain that we started to solve. After we had other steps with more value, and I will develop later. But the main was that, because when you have to organize these sessions for a patient for the next month or the next weeks, you have to download thousands of activities. Normally, you cannot customize them, or they will take a lot of time. So is one of the main parts that Neuron.app will help you out.
Yeah. So it's basically a tool for clinicians, right? It helps them put their treatment plan in place. It helps them get basically their plans, and it can individualize it for a specific client or specific patient. Is it more geared towards one spectrum, like adults versus children, or does it cover both?
As we saw in the demonstration, there you have like kids or adults, and also you have the option of digital, paper, and also one thing that is also key for this, the Neuron.app to go, that is for the tele rehab, for working from home, let's say, with patients. So yeah, it covers from adults until kids.
Yeah. And the tele-rehab platform, or the tele-rehab component of the platform, is it like a synchronous session where the individual is able to do some of the activities with the therapist there watching them, or is it kind of homework for them to do later? How does that work?
It's mainly thought for as a homework. You can track the status. So with this platform, you cannot have the chance of the patient to say, yeah, I did it, but I don't know why it's not recorded. But of course, you're gonna see the track of the activity of the patient, how many time it took, the level he was facing, and how he or she performed. So yeah, it's mainly for that. And as we said, and as a B2B platform, they will never be able to access the platform itself. They will access just the Neuron.app to go platform. There is the tele rehab platform that is a bit different. They will just go in a bunch of different activities, one by other one.
Like it's got an individual portal, Sam Smith logs in and he sees what his activities are for the day or for the week.
Yeah, exactly.
Cool deal. How many activities do y'all have on the platform?
Around, I think, more than 10,000 activities. Yeah, because we have worksheets, we have generators. You saw in the demonstration that can gives you thousands and thousands of different results with the generators, and also we have the games. So yeah, more than 10,000 activities.
Yeah. Talk to me a little bit about the games. Is there a reason behind gamifying it a bit, or?
Yeah, especially because sometimes it's about motivation or how the patient or the user is gonna face the activity. You can, by organizing the activities into sessions, you can plan. For example, yeah, this patient is gonna start so motivated, but after maybe we need to put this as he's gonna take it more relaxed or more into a game scope, so he will perform like he will be active doing this.
Yeah. Now you said when you, at the very beginning, I'm going to circle back to this. At the very beginning, you said, I'm the manager for the US market. So I'm assuming then that Neuron.app is in other places, right? What kind of markets are you in? Are you in Europe mostly, South America? How's all of that working?
Yeah, the origin of the company, we are based in Spain for the moment. Yes, in Spain for the moment, but the origin is Spanish market, of course. And now we are, yeah, all over Europe, South America. We are in Colombia, Argentina. In the US, we are already with some, I think, big centers such as Brooks Rehabilitation, Mount Sinai, Prisma Health. So we are now starting to grow a lot, fortunately, and yeah, of course, we have a lot of European. Our platform is in English, French, Spanish, Brazilian. So I think we have a lot to play with that.
Yeah, yeah. How's it been different coming into the US versus something like the European Union or something like that, where you've got a single payer system and now you're coming into the US and it adds a little bit of a complication, doesn't it?
Yeah, that was actually one of the reasons that we met each other, right?
Yeah.
So for me, it's my first 2 months in the company and just starting with this, and also in the sector is a bit different from where I have been working before. I think it's a really attractive market. Just the amount of possible clients or prospects that we can have is so big, and yeah, I think this probably is a bit more different or complicated because of the, let's say, the structure of this sector.
Yeah.
When once we go, for example, in Spain with the public health is completely different than here with Medicare. So yeah,
Yeah.
it's something that we are trying every day to improve our strategy for this, and I'm sure we will get with the US market.
Yeah. A lot of times, we talk to folks a good bit that are coming into the US from Europe, for example, or even from like India or Australia or something like that. And their big thing is like, man, I didn't realize we had to really figure out how clinicians are going to bill for this service or bill for this platform and make, basically recoup their investment in it because of this whole piece of having a third party come in and pay, as opposed to like, when you got
Yes.
single payer system where they're just getting paid for the service, it doesn't really matter. Just
Also,
adds a complicating
regarding
factor.
the US market, the American market, for example, in the Spanish market, we know perfectly all the process that a patient with Alzheimer is going to follow. But here in the US, for us, is a bit different. With,
Yeah.
we said before, with all the insurance, and Medicare, and all this, we had at the beginning difficulties to identify which process is going to follow and in which points we need to touch, or in which doors we need to knock.
Yeah.
So yeah, it's something that it gets a bit more complicated than the other markets that we already know.
Yeah. A lot of times here in the US too, it's a lot more siloed because, it's not like one single health system covering an individual. They could be going to a private practice here and a private practice there, and then maybe one hospital-based clinic here, and then somewhere else. So they they're not following the same workflow, even though they might have the same
Exactly.
diagnosis as patient B, you know?
Exactly. Fully agree with that. Yeah.
So tell me a little bit about how the software itself monitors the activity that a client may or may be doing. Is it tracking logins? Is it tracking progress? Is there an assessment component to it?
Yeah. So the platform, first of all, is configured as a, let's say, subscription for a professional, where with one subscription you can have unlimited patients. So the professional and the center will have with one license all the patient that this professional is touching or working with. Um, we for this, sorry, for this you will have a user create, and if you work with Neuron to go, you will give the patient a different code where he can enter home, and here you will have different information. First of all, you have information recorded in the system regarding the age, the educational status, the pathology, and the gender, and you will have all the tracking of their performance. Which level is he doing the activity? How many time it took? How many mistake he or she commit? All this information. And also, now taking advantage that you asking me this, the next step is we receive around 1,000 data per day, what is, I think, a lot, and is something we
Yeah.
need to work with. And we are gonna be able to develop a scoring that is gonna tell us the evolution of the patient in the last week, month, year, and also with all this data that we said with the gender, age, educational, and so on, and pathology, we are gonna be able to compare with other patients of the same pathology. Let's say, for example, if you have to do the evaluation of your patient every 6 months, and we identify that in the month 3 he's not behaving as a GDS2 and he's behaving as a GDS3, we can let you, hey Rafi, maybe you need to check this, and you need to do the evaluation before, because he's already behaving as a next level.
Yeah.
So yeah, I think that's also something that at the beginning was not into this, let's say, repository of activities, but now with all the know-how and all the information we have, we are working on.
Yeah, it seems like, especially in any kind of platform like this, where the potential is there to collect data. I mean, obviously anonymized data for HIPAA and all that kind of stuff, but the amount of value in the data that you're collecting is almost immeasurable, just because, like you said, you can benchmark people where they're at, you can follow them throughout a course or continuum of care, and then develop patterns, right? Do the folks that you have working on the development of the scoring, the hits, the misses, all that kind of stuff, are they also the ones that were involved in developing the original 10,000 plus activities and all that, so that they kind of know what's going on and they're doing this? Or are you all using a different group for that, or how's that working?
Yeah, you will. I mean, is something is not closed yet. We are working on that, and it's gonna be in the next, let's say, weeks or in a few months,
Yeah.
and it's gonna be able to get the professional to extract all the information, and in the way, or in the kind of graphic that he likes, or the kind
Uh-huh.
of the dashboard he wanna be have the information present as. And also I think that will help us to become a standard. Let's say, I mean, I who wouldn't like to have this in their rehab center
Yeah.
or in their hospital. Is something that with all this data and all this information, as you said, one of the main values of a platform is the data and the users. So with this, we can define or benchmark a lot of information.
Yeah. Yeah. That's awesome. Well, cool deal. We're nearing the end here. I always end with this. Like, if there's just one or two main points you would want for a listener to walk away with from the episode when they're thinking about Neuron Up, or things in the space, tools in the space, what are a couple points you'd want them to remember?
I want them to remember that we are a neuro rehabilitation platform that we are B2B. We want the OT or the therapists or the speech therapists to work with us. We are going to be the tool. We are not going to be the strategy itself. We are going to
Yeah.
be a tool for them, and we are going to be a great tool for them and a great help, I think, because we are saving them some pain points. Let's say first of all the time that they are taking weekly or daily to organize the sessions, the difficulty of demonstrating the effectiveness of the treatment, because with this we are going to have a record and a track of the evolution of the patient. Also, the customization of the materials is key here, because for example, if you are working with an elderly woman that has been growing in 3 or 4 cities, you can customize an exercise where the words that she's gonna find is these names of these places. It's not random names that you can put,
Yeah.
of course, with Neuron random, but I think we can play with this customization that is gonna help a lot. Also, the tele rehab is something, especially with the situation of COVID, is something that a lot of people has jumped on already. So we provide this service. We give them also a key differentiation or innovation point that is not going to be affordable or available in other platforms.
Yeah. Awesome. Well, where can people find out more about Neuron Up? And then I'm sure you're the point of contact, right, for the US. So where can they find and connect with you?
Yeah, of course, they can reach us on the website neuronup.us, of course on LinkedIn or any channel that if they looked at on internet, we will be there ready. And also I think one of the best things I can recommend to the ones that are interested, apart from reach us, is they can do set up a free trial, completely free for 15 days, where they can start using the platform, and we will help them in all the process.
Awesome. Cool deal. Well, Miguel, thanks so much. Have a good one.
Thank you so much, Rafi.
Well, I hope you enjoyed that conversation with Miguel, talking about Neuron Up and really just leveraging technology to improve and to streamline. One of those things that anybody who's been involved in patient care at any level, especially in the ancillary healthcare space where you've got patients coming back multiple times, you're setting up treatment plans or structured programs, it can be very unwieldy to have a bunch of paper sitting around, a bunch of sticky notes everywhere, files and files. You know, I've run a physical therapy clinic as well. We do physical and occupational therapy. And when I bought the clinic, we just had file cabinets full of home exercise programs for rotator cuff, low back pain, you name it. Sticky notes everywhere, notes written all over it. And trying to get something that was streamlined, that was one, evidence-based, because again, if it's sitting in a file cabinet for years and years and years, obviously, or you could at least assume that it's not being updated regularly. So you've got these tools or these exercises that are being used over and over again. They're probably aging and falling out of current best medical practice or best medical evidence. So that's the first big problem. And then the second problem is that from a patient engagement standpoint, you're handing this patient a paper that's probably going to get thrown on the dashboard, under the front seat of the car, wherever, and they're never going to see it again. And then they're not going to do whatever the exercise is or complete the activity or you name it. There's going to be a reason why they can't do it. So finding a way to take something that we all do, that we all kind of take for granted as clinicians, and revamping it or innovating the way that it's delivered really can help improve clinical outcomes in the long run, because you're boosting the engagement. You're getting the patient or the client to log into the platform. It's being delivered in a convenient way. You can track what's going on. The patient should know you're being able to track what's going on, which helps with compliance, right? So I love seeing innovation in healthcare. Again, taking something that is one of those things that we might not even think that much of. It's, well, if it's not broke, don't fix it, right? But if you dig into it, there's a lot of reasons why you want to innovate, especially around home programs and adherence. They say one of the biggest reasons why chronic conditions and the like have such poor clinical outcomes is because of patient compliance. Well, how much of that patient compliance is self-imposed because we're handing the patient paper that's getting crumpled up and thrown away. So that's all I've got on that topics. If you like the show, head on over to iTunes, leave us a rating and review. If you want to be notified whenever we drop a new episode, you can head on over to www.betteroutcomes.show or rehabilipracticesolutions.com. Drop down in the menu from insights to podcast, and then you can sign up there. We send out the show notes, which include links to our guests and their contact information and all that kind of stuff. And yeah, we're going to be trying to this is going to be my plug here for the YouTube channel. So we're starting up a YouTube channel at RehabU in the fledgling stages right now. But the goal is to begin doing some of these podcast episodes on video. So you've got another way to consume the podcast or participate in it, if you would. Moving into 2023, I'd really like to do some live panel discussions and live shows here. So keep on the lookout for that. And moving into 2023, we are booking out the work that we're doing with clients and organizations, primarily around my speaking, my training, my consulting work with clients. So if you are interested in having me come speak or train at your clinic or organization about leadership in healthcare, patient engagement and experience, integrated clinical care models, interprofessional collaborative practice, and the big one for us recently has been marketing and communication strategy for ancillary healthcare professionals and platforms. By all means, reach out to us. Head on over to www.rehabilipracticesolutions.com. Under the What We Do tab, you can read about the speaking and training, about the consulting, about the ultimate patient experience blueprint, if that's something you're interested in. My work on telehealth in particular has been discussed in Forbes. So we do have something called the Telehealth Roadmap, where we help organizations and clinics implement virtual service delivery at their organization. So you end up getting basically the standard operating procedures, training for your staff, how to educate patients on telehealth and virtual service delivery, and the like. And then some of that ties into as well the front end business development, right? So if that's something you're interested in, head on over to Rehab Practice Solutions, click the What We Do, and then just kind of browse around, see what your heart desires there. Or you can shoot me an email at Rafi, R-A-F-I, at rehabilipracticesolutions.com, and we can get something on the calendar. If you'd rather just cut the reading time out and just go straight to scheduling something and having a conversation, more than happy to do that as well. So again, Rafi at rehabilipracticesolutions.com. Do that, and we'll get someone from my team will reach out, and we'll get everything squared away for a time on the calendar. Alrighty, until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabilipracticesolutions.com. We'll catch you on the next episode.